too. All right, good morning. Welcome, everybody. Thank you for coming. My name is Dr. Jim Hubbard. I'm a pediatrician in Dubuque, and I'm the current president of the Iowa Medical Society. Since my early days as a physician, I've been an active participant in organized medicine. In the last few years, I've become concerned, like many of our colleagues, about how our state's physicians are going to continue to care for our patients given the unique dynamics facing Iowa. So last May, I appointed a task force to examine several key facets of Iowa's healthcare system and the challenges they present to physicians in delivering high-quality care. We have a tradition of excellence in healthcare delivery in this state. Every time the quality indicators come out, any study that's done, we're consistently in the top 3, 4, 5 places in quality for care for Iowa. But we do have some serious challenges, and I felt it was time to take a closer look at these, a more studious approach to these issues of what's actually happening in Iowa's healthcare system. I was fortunate enough to have 11 doctors agree to take time away from their practice to participate in a task force which we called the IMS Task Force on Iowa's Healthcare Infrastructure. And I asked our task force to look at 4 main areas. First area, Iowa's physicians workforce. Second area, medical education and training in Iowa. The third area, caring for Iowa's uninsured. And the fourth, Iowa's public health system. So obviously a big job, but this task force was well up to the challenge. As a result of their work, it's clear that Iowa does have unique challenges when it comes to delivering care. The task force reports highlights how critically it is to properly fund our health care system. We have a high percentage of elderly patients in Iowa, and as a result, anything that impacts what Medicare pays physicians to care for these patients is important. What's happening now is that Medicare is cutting what it pays to doctors to care for elderly patients. And this is happening nationwide and also happens more so in Iowa. It penalizes doctors who practice in rural states by paying them even less. These shortages affect the entire system, and eventually it will impact everyone regardless of age. So to give you a more complete look at at the work of the task force, I would like to introduce Dr. Charles Helms, who did a wonderful job as chair of our task force, to talk about our group's findings. When he is finished, I'll introduce IMS President-elect Dr. Patricia Hoffman, and she will discuss our intent as a medical society to explore litigation to maintain the quality and efficiency of our healthcare system in our state. Dr. Helms.
Thank you, Dr. Hubbard. It's a real pleasure to be here representing the 11 members of the committee, all who've worked very, very hard on this important work. It was my pleasure to chair the committee. I learned a great deal in the process that we all had together. We began our study, which wound up, by the way, with a document which I'm holding up here in front of you. This document is full of information which is very, very helpful and interesting, I think, particularly for physicians around the state. We hope that this is going to be the basis by which we as physicians can come together very tightly around certain healthcare policy issues in the state. There are over 40 recommendations within this document, all of them within the various 4 categories that Dr. Hubbard brought to your attention early on. I'm not going to go through all of those, obviously, but what I would like to do is to tell you some things that hit me as chair of this committee that I think Iowans should, first of all, be proud of, and secondly, where we all should be working together to try to improve the situation in terms of health care policy, specifically around physicians' needs. The first item I'd like to bring to your attention is some very good news. And that very good news is actually been good news for a few years, and that's about the quality of care in this state. We are very fortunate in the state of Iowa. We physicians, nurses, other healthcare professionals, the hospitals and so forth, to have ranked 5th in the country, according to the Commonwealth Fund, in a study done in 2007 in terms of quality of care. 5th. I can't remember exactly where we rank in terms of physician, for example, reimbursement in Medicare, but it's at the other end of the line, probably down around, in terms of numbers of states, probably around 45th or below. Can't tell you that for sure, but it's very low. We're getting a very high-quality product in this state in terms of care of patients and very low in reimbursement. People would say that's extremely valuable, and we all should be proud about that. At the same time, as we found that data out in the work of the task force, we found that there are certain things within the state that we've got to be concerned about. One of them has already been brought out by Dr. Hubbard, and that's Medicare reimbursement, something we're very concerned about, physician reimbursement in regards to that. But also, we've got other concerns in terms of the numbers of physicians in the state, specifically and importantly in the area of the specialties. Specialties such as psychiatry, specialties such as some of the surgical specialties and so forth, where we don't have enough doctors around. And where, if time continues to move forward and this gap in the numbers of these specialty physicians continues, the whole quality issue may be at risk, and we may see decreases in quality. And we're very concerned about that as a task force. In fact, many of our recommendations were based on trying to improve the numbers of physicians in the state through various means and methods. We looked at the medical schools within the state and examined what they were doing and became convinced that they're doing a tremendous job in terms of educating high-quality medical students in the state of Iowa. There's no question about that. What's happening after these students graduate is that many of them, and we would expect many of them, to leave the state. The thinking was that it would sure be nice to try to keep as many of those students here as we can possibly do it. And we began to think about possibilities and ways of accomplishing that. It is a very complex problem with financial issues associated with it as well, related to reimbursement. And we obviously didn't come up with a specific answer. But what we did come up with was, I think, a commitment by those members of the task force who were from the institutions, the educational institutions, to work together to try to improve this situation with medical school graduates. In addition, to try to work together with the communities around Iowa to attract physicians, the necessary specialists, to make sure that there are sufficient physicians around the state to deliver the care that we need. We also were thinking about another factor which is going to make a difference in terms of attracting physicians to the state, and that was the whole issue around malpractice insurance and litigation within the state. The IMS has had this high on its legislative agenda for years. There have been some good things that have happened in the state. The most important thing we're in favor of right now is the whole certificate of merit scheme in terms of malpractice. And that is basically having a specific individual, a careful physician or someone else trained in medicine, review a case which is being brought forward for its merit. Should it be brought forward at all? Should something else be done? That gives you the bottom line of this particular type of approach. We're in favor of that, and we'll be continuing to push that forward. This will benefit not only, I think, the malpractice climate in the state, will make litigation available to people who have been harmed rather than those who may not have been harmed, and will improve the status greatly within the state of Iowa. I'm going to stop my summary here and pass the baton on to you, Patricia.